Welcome to Empowered Health. This week we have another show packed with information to help you empower your health.
That's right. We are going to see what a flight simulator can do for your spine. And Wendy Shore's back to talk about acne.
But first, let's take a look at another inspiring story of integrated health in action.
I forgot I threw some stuff on the scissor lift when I first got on there and I tripped backwards on it. And that's basically the last thing I remember. And I woke up in the hospital with all my family around me a couple days later.
His family didn't think he was going to survive. He'd just shattered his body, his skull was fractured, his neck was broken in 4 places. He'd smashed his arm, wrist, hip, ankle. Basically everything on his left side had been destroyed.
So what the figure is when I stepped backwards and I fell, it's either I fell and I hit my head on the scissor lift when I fell backwards, fracturing my skull, knocking myself out, and then free falling 20 feet onto my left side.
Dr. Mark Matashek at Royal Columbian Hospital put him back together again. It was a long and painful process. John says it took him a long time to come to terms with the full extent and the severity of his injuries. He says he was numb to what had really happened to him because he was loaded with drugs designed to kill the pain.
But I thought everything was fine because I was taking so much pharma. And when I woke up, the pain was excruciating. They gave me a bunch of drugs and I was like, oh, things are great, woohoo, I can be able to do this, right? I started chasing pain. They give you your painkillers, you push your button. The last 3-4 hours, all of a sudden it's getting worse. And you push that button again real quick. In order for me to function, I needed the drugs in order to move.
John left the hospital gobbling down 32 pills a day, drugs that were costing a fortune, $1,400 a month.
I was a walking zombie and my friends around me, I lost a lot of friends because I wasn't that person. I started reading what was wrong with me, what these drugs are doing to me, how I can start leading a better quality of life.
Then, one day he paid a visit to the BC Compassion Club where he tried medical marijuana as a form of pain management. He was amazed with the results.
I started reading more and more about how this was helping me. And slowly started weaning myself off of pharma and taking amino acids, natural supplements, converted forms of THC, have creams for my knees when they were getting really bad. And over time, I just stopped using the pharma. My psychologist and everybody around me said, wow, night and day.
Today, John sees his doctor once a year to renew his medical marijuana license, which costs him about $500 a year. A license that has allowed him to kick the pharmaceutical habit.
In acute stages of pain, I don't think cannabis could help me with that excruciating pain that I was in. Pharma was needed. But when dealing with lifelong care with traumatic pain or injury, pharma is not something you use for your whole life. Now I'm balanced.
Coming up on Empowered Health.
Acne sucks, and at some time in our lives, all of us are going to have to deal with it. Acne sucks, and at some time in our lives, all of us are going to have to deal with it. Food has been suspected as a cause of acne for generations. In popular magazines and the internet, that popular source of reliable information, profess with authority which foods you should avoid to win a clearer complexion. Sugar causes acne, chocolate causes acne, fatty foods cause acne, milk causes acne. Wouldn't it be great if life were that simple? The real answer is probably none of the above. Despite the best efforts of scientists over the past 150 years, there really isn't any evidence that you can point the finger at any one food as being a cause of acne. A review of several dozen food-related acne studies by Australian researchers found no convincing evidence that any particular food enemy causes acne. They also debunked popular notions about sunlight and expensive cleansers being effective treatments for acne. There are a couple of British studies that suggest that being overweight increases the likelihood that you'll suffer from acne, and that connection may be the basis for all the food myths. A balanced diet, generally good health, and adequate sleep might have a positive influence on acne outbreaks, but no guarantees. So if food enemies aren't to blame, who is? The absence of essential fatty acids that reduce inflammation might make outbreaks worse. For instance, A recent study found that radioactively labeled fatty acids fed to guinea pigs made its way to the fur of the animals. A similar study of 45 human women demonstrated decreased skin irritation. Well, that's good news if you like fish, nuts, and olive oil, but don't expect a big change. The scientists were studying skin reaction caused by an irritant they applied to the women, not acne per se. One small study found that university students reported worsened acne during exams, which is typically a time of increased stress and poor sleep habits. A tendency to suffer from severe acne appears to be at least partly inherited, probably due to the action of certain hormones and your sensitivity to them. So, there really isn't much evidence that acne is anything more than bad luck. Some people get it, some people get it bad, and for other people it's just not a problem. So have a piece of chocolate. Scientists say it might make you feel better. I'm Randy Shore for Empowered Health.
Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always starts with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive the appropriate diagnosis and care from a qualified chiropractic doctor today and tomorrow. That's also why BC's chiropractors fund research and education. Today, I want to introduce you to Dr. Greg Kotchuk, who is working with another innovative diagnostic tool, a flight simulator.
What we have here is what essentially is a flight simulator, but instead of recreating cockpit information and flight paths, what we can do is put in any type of movement information and recreate it here in our lab.
Flight simulator technology is used in a variety of different fields, from medical research to video games, in order to analyze and capture human movement. In this case, the device has been focused on the muscles that control the spine.
Well, as you can imagine, we always can't get our research equipment into the places where people work, or they do their sports, or wherever they have their back problems. But we can take certain things into those work environments, record what happens, and then replay it in our robot here. And that gives us a chance to study what's happening in a controlled environment.
It's like an EKG for your heart. You can monitor how someone is doing while they are at rest and while moving.
We kind of do the same thing here, where we can certainly measure some things with people at rest, but if we put them on the robot, we get to see how their core muscles work in a standardized set of activities. So what the robot will do is it will tell us if certain muscles are turning on or off at the correct times, as well as how much they're turning on or off. And that can tell us if certain parts of the trunk are weak or need attention.
Once we know if there are weak spots, the robot can focus on them, selectively training them using an individualized exercise plan.
What we do know is that people with back pain problems do contract their muscles differently at different times and in different ways. And what this device allows us to do is to really investigate those possibilities, because simply being in a clinician's office and bending down and touching your toes doesn't necessarily reveal all the problems that that person can have. So in this case, this gives us individualized information about someone's musculoskeletal system, and from there we can tailor individualized care for their specific problem.
As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow with better health outcomes for you. The College of Chiropractors of BC sets the standards for safety, outcomes, and your informed consent.
Hey guys, this is your Simple Fitness Tips. My name is Jameson Wolf and this is Simona Marion. Today we're going to show you how to perform and progress the reverse crunch. The reverse crunch is great for hitting the lower abdominals as opposed to the upper abdominals. Alright Simona, I'm going to place this foam roller between your ankles and your thighs and you're going to pinch it. Perfect. Notice how Simona has her hands on a medicine ball. This is going to help anchor her down as she raises her hips. Okay, go ahead and draw in your core. Good. And exhale as you come up. Good. Exhale. Good. All the way down till you tap the feet. Good job. As she gets good at this, she can now anchor herself with just her hands. Nice job. Beauty. As she masters this, she can now use a dumbbell and place it between her feet. All right, try this out, and we'll see you next time.
After the break.
A benefit of where refractive lens exchange over laser surgery would be something like where there's a cataract that's developing.
We're back. Next up, we're going to check out our reoccurring sleep segment and talk about an issue with which many people deal: sleep disorders.
Well, that's really an important one, Michelle. And stay tuned, as later on in the show, I'll be getting some tips on making smoothies from Chef Julia Olton.
I'm joined by Dr. Michael Bruce, the sleep doctor. And today we're going to talk about sleep disorders. Insomnia is something that can drive you crazy. What do you do to overcome that, or to put it aside so that you no longer are an insomniac?
Sure. So there's really 4 different areas that we see happen with insomnia. And by the way, all insomnia is not created equal.
It's not?
No, it's not. There are people who have a hard time falling asleep. There are people who have a hard time staying asleep. And then there are people who wake up too early. So there's actually 3 different types. Believe it or not, there's even more types than that. We've got people who have insomnia because of pain, depression, anxiety. So one of the first things we do to try to understand insomnia is look for the root cause. So where is it coming from, and what type of insomnia are you suffering from? Only then can we develop treatments to be able to help people with that. And by treatments, I don't necessarily always mean medication treatments. There are a lot of behavioral treatments, talk therapy treatments that can be highly effective in helping somebody with insomnia.
So is insomnia kind of a mental disorder, or is it a physiological?
It's both. So we know that we can actually make somebody an insomniac very easily by uttering just a few words to them.
Don't tell me, I don't want to know what they are.
Right, well, we could tell them something is wrong with them physically or mentally, right? We could say, you have cancer. If somebody told you you had cancer, you wouldn't sleep very well that night. So there's a tremendous emotional component to the idea behind insomnia. I would tell you that 75% of my patients with insomnia absolutely have a component of either anxiety or depression that's commingled with either a medical disorder, a medication side effect that they're taking, or just bad habits that happen during the day.
So what's the most important thing that they need to do to change in their life to help address their challenge in getting to sleep?
So I would say there's 5 steps that people can take to really help them get a great night's sleep if they're suffering from insomnia or just not having a great night's sleep in general. Number 1, consistency. Make sure that you have the same bedtime and specifically wake time every day during the week and on the weekends. That allows your circadian rhythm, or that internal biological clock of yours, to stay on cue. Number 2, I ask people to become decaffeinated by about 2 p.m. I didn't say you can't have your morning cup of coffee or even your afternoon iced tea, but by about 2 o'clock in the afternoon, that's when we want people to stop drinking caffeine, because caffeine has a half-life of between 8 and 10 hours. Step number 3 is stop drinking alcohol about 3 hours before lights out. Again, if you want to have a beer, wine, or spirit with dinner, that's fine, but you don't want to go over 1 or 2, and you don't want to have it too close to bed, because while it makes you feel sleepy, it will prevent you from getting into deep sleep. Right? Number 4, don't exercise 4 hours before bed. Too much arousal autonomically will prevent you from being able to sleep. And the last one is get 15 minutes of sunlight every morning to help, again, reset that circadian clock. If you follow those 5 steps, I can almost guarantee you're going to be sleeping better.
Thank you very much. And thank you for joining us on this segment of Empowered Health.
I had lens replacement in both eyes.
That's Diana. Her family has a history of myopia, and she's been wearing bifocals since grade 1. She managed with glasses and contacts until her vision started to change in a way she could no longer ignore.
Well, first of all, I started seeing these little black floaties. And I'm getting ready for work one morning in the mirror, and I thought a fly went by me, and I'm trying to find it, right? And then it happened again, and I thought, oh, time for an optometry appointment. Phoned up Dr. Lamb, and he explained to me what they were. And he said I was probably beginning to get cataracts. And the thought of the surgery just freaked me. I have to admit it did freak me, and he knew it.
So let's back up a bit. What exactly is a cataract, and who do they affect?
We have a lens in our eye that focuses like light, like a camera, and over time it can get yellow and brown. The lens grows layers like an onion, and as it gets thicker and thicker, it's going to break down. Definitely aging in general causes that change.
The fact is, most people will develop cataracts if they live long enough. Environmental factors such as sun exposure and smoking can contribute to cataract formation. But when it comes to talking about cataract treatment, well, how exactly does a lens exchange differ from laser surgery?
A benefit of where refractive lens exchange over laser surgery would be something like where there's a cataract that's developing. So when someone has a cataract and you're thinking of a refractive type of procedure where we can clear the vision, it can also remove the obstructions in front of the eye, whereas laser surgery can't. So you can still have laser surgery and still develop things like cataract. Whereas with cataract surgery or refractive lens exchange, you're taking that lens out so a cataract can't develop. But a lot of people don't know that cataract surgery is one of the more common surgeries there is in the world now. And it's all outpatient. You can go in there for the day and be out that same day. You don't have to be hospitalized, there's no stitches. Technology is really advanced.
Diana breezed through cataract surgery with flying colors. Today, she's still amazed with the results.
The trees were green, but they were shades of green. And I couldn't believe how many shades of green I was missing in the trees. You don't realize what you're not seeing until you can truly see.
Coming up on Empowered Health.
Everything's smoothies today. Yes, we're going to get our fruits and vegetables all in one nice drink.
This cooking and nutrition portion brought to you by Save On Foods.
When the weather is nice, it's really fun cooking outdoors, and we've brought cooking on the patio today with registered holistic nutritionist Julia Alton. Julia, welcome to Empowered Health.
Thank you for having me.
Today is a smoothie recipe, right?
Everything's smoothies today. Yes, we're going to get our fruits and vegetables all in one nice drink.
So we start with the blueberries?
We're going to start with the blueberries today, about half a cup of blueberries. And then we're going to put some spinach in here. This is kind of it's not a trick, but for younger human beings who might not like their vegetables.
Absolutely.
We like to sneak in as many greens and healthy vegetables as we possibly can. And this is one of the ways you can actually hide it.
Right.
So we're going to put some strawberries in here as well. And mango.
Right.
Mango gives it a really smooth texture, but it also adds a
to the
punch
flavor.
of vitamin B's and
Right.
wonderful fiber. We're also going to add an avocado.
This is going to go in the smoothie as well?
This is going in the smoothie.
Okay.
You know, when you have an avocado, sometimes it gets to the point where it's not past its prime, but it's almost.
That's true. You can't really use it in a salad anymore. Yes, I hear you.
It's a perfect way to use them. It's got wonderful omega-3 oils, and you do not taste avocado in this drink. I can guarantee you that.
Oh, that's a good idea. So
that's another healthy addition. We're going to use pomegranate juice this morning.
Okay.
It's good for young and old.
Okay.
And we're also going to put some coconut milk in here. Everything that's in coconut oil is pretty much in coconut milk.
Okay.
And so it gives it a nice flavor as well.
And now the juice?
The juice, you can put the pomegranate juice in. Now
all of it?
Yeah, I would put the whole thing. The recipe calls for half a cup. But for those of you that don't want to use juice, you can use just the coconut milk. You can use orange juice. You can use almond milk, rice milk, any of those things. And the other thing that smoothies is really good for is adding fiber and protein.
Right.
So the fiber, you can sprinkle in flaxseed.
Right.
You can sprinkle in hemp seeds. We're going to use hemp seeds today. And they've got lots of protein in them and also good fiber, excellent source of protein and fiber.
Right.
You could use something like almond butter, a couple of scoops of almond butter.
Yeah, that'll really smooth out the smoothie.
Yeah.
Yes.
And so you can add whatever type of protein you want in your drink, just to give it that extra oomph. So I'm just going to press the blend button, so we'll hang on.
Julia, it's all blended up and the color looks fantastic.
That's a big part of these smoothies. You got to make it look good.
Looks tempting.
Cheers.
Let's try this. Really good. All the flavors, all the texture, and the best part is we didn't add any sugar into this either.
No sugar.
And tastes really good. Well, thank you for being on the show and showing us this recipe. You can find out more about it on our website on Empowered Health. Smoothies are quick and easy to make, and when done right, they can be a meal on their own. I've got registered dietitian Crystal Higgins with me to talk to us more about smoothies. Crystal, welcome to the show.
Thank you.
A lot of people are making smoothies these days. What are the nutritional benefits?
Well, as you mentioned, a smoothie can stand alone as a meal or can even be a snack. It's a great way to incorporate different varieties of flavors, textures, and a full spectrum of colors too. They're very easily adaptable for gluten-free diets and makes it a bit easier to meet your daily quota for veggies and fruits.
Fruits, I understand. You mentioned veggies. What veggies can you add to a smoothie?
Well, something like spinach packs a huge nutritional punch without adding very many calories. It's very high in folic acid, magnesium, vitamins A, C, and K, along with many other micronutrients, and it has sort of a mellow, slightly sweet flavor, so it blends and combines very well.
You mentioned spinach, and spinach has great nutritional benefits, but there are some people who don't like spinach. So what can you add to a smoothie if you've got spinach in it to add more flavor to it?
Well, surprisingly, you don't even really taste the spinach as long as there's other fruits and flavors that are mixed in there. One of my personal favorites is making a green monster smoothie, which has spinach, banana, peanut butter, chia seeds, and almond milk.
That sounds like a nutritious monster that's gonna crush your appetite.
Precisely.
So I'm guessing it'll be good for a breakfast then?
Yes, definitely. Smoothies are a great on-the-go option for breakfast, and when done right, including things like healthy fats such as peanut butter, avocado, or the fiber and omega-3 rich chia seeds help to give it a longer staying power. If you are using it as a meal replacement, I would encourage adding a little bit more protein, so something like some Greek yogurt or protein powder.
Well, Crystal, thanks for being on the show, taking the time to talk to us and telling us about smoothies.
Love it. Great. Thank you.
Well, that's all for this episode of Empowered Health. It's always amazing to me, VJ. I think you can put literally anything into a smoothie and it will taste delicious.
That's true, Michelle, and I'm telling you, smoothies are the easiest way to cover all your bases nutritionally. Be sure to keep in touch by following us on Twitter, and we'll see you next time.
Bye for now. Thanks so much for watching.